Good afternoon, everyone. Good morning or good evening, wherever you are, whatever time it is for you, and welcome to this ICN hosted COVID webinar. I'm going to say that only once. This is our second webinar of the day. Earlier, we had a webinar with our associations from Asia. We've had over 50 countries participating so far, and you are all extremely welcome this afternoon, or whatever time it is for you. We know that these are quite unprecedented and extraordinary times that we are living in, and we know that you and our profession are absolutely at the forefront of responding to coronavirus. So I firstly wanted to thank all of you for taking the time to be with us now and to connect with us. And I particularly wanted to thank those speakers who are joining us from the associations, our national nursing associations. From the very beginning of the year, the outbreak of coronavirus, the ICN, our president, Annette, and I have been in close contact with the countries, with the nurses and with the associations who have been most affected. We've followed the peaks around the world, and it was very, very clear to us that not only was there some incredible work that was being done by nurses, but that experience and that learning needed to be shared much more widely. And that really, colleagues, is the purpose of these webinars that we're holding today, is to bring the learning, the experience, the support, the challenges to the global nursing community. This is a global crisis. It requires a global response, and ICN wants to help with that coordination, that global coordination and solidarity as much as we can. Though, of course, our colleagues at the World Health Organization have absolutely been in the lead in relation to those global coordinated efforts. And I'm very, very grateful to have Elizabeth Ero, our chief nurse, with us for this webinar. She was also with us this morning, and we've also got colleagues from WHO's workforce department and infection prevention control department, who, as you can imagine, have been incredibly busy. So our sincere thanks to them as well for finding time to join us this afternoon. Colleagues, before I move to the speakers, you'll know that there's both a question and answer button, and there's a chat button as well that you can use as participants to this webinar. Could I ask you, if you have questions, please use the question and answer button, so it makes it easier for us to see your questions and your issues. And just to say to everyone, all of the materials will be shared from this webinar, from this morning's webinar. All of the questions and issues, we're capturing those as well, and we'll be making those available later. So colleagues, without further ado, now I'm going to ask our president, Annette Kennedy, to welcome you and to say a little bit more about the work that ICN have been doing. Annette, over to you.
Thank you, Howard. Can you hear me? Oh.
Yes, we can very well, Annette. Thank you.
Okay, that's fine. Good afternoon, morning, evening, everybody, and thank you very much for attending this webinar. Thank you to our colleagues from WHO, Elizabeth, Catherine, and Marie Claire, and also thank you to the speakers, Jose Luis from the General College of Nursing in Spain, Walter from the Italian Nurses Association, and Rosita, who is a board member and also head of development in the Swiss Nurses Association. So thank you very much for your participation. This webinar, as Howard said, is about sharing information, and it's about communication. And we can never have too much communication in this day and age, both from you and from us to you. It has to be a two-way. It's an extraordinary time. We've never experienced this in our lifetime, but we will get through it by working together. You know, the interesting thing is that when we chose the title for our International Nurses Day guidance documents, we chose Nurses a Voice to Lead, Nursing the World to Health. It was never so apt as it is today. We didn't realize it at the time what we were going through, but that title is very much apt today. When the World Health Organization designated 2020 as the year of the nurse and the midwife to celebrate and showcase nursing, we never thought we would be celebrating it or showcasing nursing in this way. But we have seen the very best of nurses, the very best of our nursing associations. And you know, we celebrate the bicentenary of Florence Nightingale. And 100 years ago, more than 100 years ago, when she was in the Crimea War, her main contention was that more people are dying from infection than were dying from their war wounds. And that is so apt today. I'm sure she would be looking down at us saying, have we learned anything? Anyway, I would like to just talk to you a little bit about the work that ICN is doing. We've been working very closely with WHO on various committees and with our colleagues in the workforce, and particularly Elizabeth, our chief nurse. But we've also been on various committees since the beginning of the year, and since we heard from the Chinese Nurses Association about what's happening in their country. And they very quickly came to us and asked us for assistance, particularly in relation to protective clothing, protective equipment. And of course, China is the biggest producer of PPE. So we could only help with funding, some funding. But from the very beginning, we started talking to our colleagues in WHO and bringing all the concerns to them, and particularly at the very head of the organization, Dr. Tedros. The NNAs started then telling us all of their concerns, and particularly the very first countries like China, Taiwan, Italy, Singapore, Iran, and of course Spain, and many other countries since that. So we started to bring that knowledge together and to share it, and we started to put it on our websites and to use the videos that we were getting from them as well. And we were sending out information because, as you know, not all countries can have access to all the IT technology that many of us have. We have been using social media to get our messages across, and Howard's given a number of interviews in many of the world media agencies. We've issued regular press releases. We have sent letters of support, and unfortunately we've had to send letters of condolences to those countries who have had nurses give the ultimate sacrifice in their death. This is the first webinar, but we plan to have more of those, and possibly in region. For us in ICN, things have changed dramatically. We have had to change the way we do business, and for our priority is now to communicate. The safety and the well-being of nurses, protecting them, saving lives, and saving the lives of the people in their care is our priority. We also would like to see more nurses in strategy and policy, and this is something that we'd like to hear from you on. We know that our NNAs have been very active with governments in this respect, and they have shown their great work and what they can do to lead the way in relation to informing strategic development in their countries. But still we see the physical and psychological stress and the pressure nurses are under. And now we will see some of the pictures of exhausted nurses. Just because you're looking at COVID-19 on your screen, it's not me, thank God. Cyril, can you go to the next slide? These are pictures of Korea, top clockwise to top left, where they're getting together to strategize. We have on the right, Italy, where they're looking at their task force. And if you see, I have to admire the nurses all around the world, no matter what stage they're at, they come out with enthusiasm. We have South Korea at the bottom, getting food, meals for patients. We have Italy. This is a very famous picture, I think, that has gone all over the world. An exhausted nurse grabs a few minutes at a station. And down at the bottom, we have Iran. Next slide. These are stories from China. In the very beginning, when we heard, as you know, the Hubei province was the center of the virus. And we heard from President Wu very quickly. And she told us that time that they were having great difficulties. And at the time, you have seen some pictures of 28,000 nurses who left their homes to go to Hubei province. You saw also that 50% of the country's ICU nurses left their areas to go to Hubei. Almost 5,500 ICU nurses went there. The president was on TV. She was doing a lot of interviews and was in constant communication with us and has sent us some videos of their work there. This at a time when they had almost 3,000 cases positive a day. And now they're on the other turn, which is great. But what they did was they gave us time to prepare. Only for China, we would not have had the time we have to prepare. And a lot of countries are at different stages of the virus now, but we still have to work at it. But these are all different pictures that you have seen, that we have seen. And the biggest thing of all is that we have heard is the exhausted nurses, the difficulties in getting, not just getting PPE clothing, but of actually putting it on, taking it off, and having it on for hours. And you've seen faces with the tracking of it on their faces and the difficulties even in breathing and talking through their masks. It is so, so hard on all the nurses. It's not just their job. It's the clothing and everything else they have to do besides. Next slide. This is, as we have said, and before I just say that, because the slides are slightly different to what I expected, but anyway, I'd like to just say one or two things about Taiwan and South Korea. In South Korea, they had, they flattened the curve, and you hear about, they talk about flattening the curve. All we're talking about is flattening the curve, because it is very difficult for any health system to deal with a peak in the number of patients that they get into their hospitals. Nobody has been prepared for this. Nobody has been prepared for how sick people will be in intensive care. So it's all about testing, 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 and trying to flatten the curve. And that's what South Korea did. They tested, tested, tested. In Taiwan, what they did differently was that because they had experienced previous SARS virus, they already had some plans in motion to deal with any further virus that they may experience. And they have quite, and we will send you on, because they were on this morning, we'll send you on the Chinese PowerPoint, and we'll send you on the South Korean PowerPoint, all of which had very different examples of what they're doing. But it's important that you see what they did and that you take from it. This, as you know, as I said, is the anniversary, the bicentenary of Florence Nightingale. She might be proud of what we're doing, but she mightn't be proud of what the world is doing. And as I said, we have been supporting National Nurses Association, coordinating information, sharing learning, which is the most important thing, because this is new to all of us. And even how we do infection control, what we do, how we look after the patients is new. And you can't expect people to automatically know exactly what to do, particularly our nurses who are at the front line. So we're working with WHO and NNAs on technical guidance and good practice. We're advocating for our health workers' rights constantly, talking about the protection, because if we don't protect them, we don't protect our patients. And informing public health policy. This is what we're doing regularly. We cannot do enough about informing you, getting the information from you and feeding it back. Next slide. We have been sending, as I said, messages of support to China. And when we started sending out the messages, we didn't realize how much they would mean to our NNAs and our nurses in those regions. And we have been sending out videos, messages with them to improve the morale. And it has had such a great response. We have continued to send them out. And to any of the countries, particularly those countries at the height of their pandemic at the moment. And I think you may have seen too, the different things that countries are doing. And even in my own country, in Ireland and England, last night it was clapping, getting the world to clap at 8 o'clock. It does make a difference. People are very, very encouraged by it. And we have to keep the morale of our nurses up. There's no two ways about it. They're doing a great job. Next slide. Next slide. Okay, this is what we have been trying to get your message across on all the media, not just social media, but on general media, Sky News, Reuters, Euronews, BBC, CNN. And if you look, last Tuesday, Howard had an interview on BBC World, and it is a very good interview about the difficulties for nurses. So I suggest that you look at it. It is one of the best interviews that we have seen. And he was lucky. It's sometimes difficult enough to get these interviews, and our communications department were very good in order to try and get it. Next slide. I just want to say one or two things about Ireland, because I didn't say anything about Italy because Italy is here. I didn't say anything about Iran. Iran was one of the countries that came to us first because they had 2 nurses who died. We know that so many have died since, but they were the first ones to talk to us and ask us for a letter of condolence. And it upset us, it upset everybody, and so many nurses have died in so many of your countries since. And we have to honor them in some way at some time. But just to tell you that in relation to Ireland, just a few quick things. Some of your countries have said that the rate of infection in healthcare workers has been around 9%, around 12%. In my country, here in Ireland, they're saying it's between 20 and 25%, which is very, very high. We don't know why. The average age of people that are positive with the virus is 44 years. Although the people that die, the average age is 79 years. But the 79 years might be older if you have one that's a younger person in that, so that statistic isn't so perfect. The other thing that we have been talking about is that every country seems to be gathering information differently, and it would be nice if we could have similar information to compare, and particularly in relation to what's happening with nurses. It may be that we can't do it now, but it may be that we should be doing this later. So that's all I'm going to say, except one last thing, which is kind of nice, is that although we were celebrating the Year of the Nurse for 2020, we will hopefully push it out to 2021, because we cannot celebrate really this year, but we will need to celebrate the best of nurses and the best of nursing next year. That's for sure. Thank you, and it's over to you.
Annette, thank you very much for that very comprehensive overview. As Annette has explained, the work of ICN has been concentrated broadly in 3 areas in relation to health worker and nurses, protection and their rights. Annette and I have both had the opportunity to talk about PPE to the Director General, Tedros, We've also been speaking regularly to colleagues at WHO about the importance of supply, of distribution, about the real concern around rising health worker infection rates, which we believe is tied to the lack of PPE, the importance of things like rest breaks and compensation, and equally that this is not just about dealing with the physical health issues, the mental and psychological health issues and pressures for nurses are very, very significant. We have tragically had reports of 10 deaths of nurses in recent days from around the world. And just in the last 24 hours, a nurse who it's reported committed suicide. So the protection of nurses is absolutely the forefront of our work. Of course, we're also supporting bringing forward clinical and technical guidance. We've worked closely with WHO on that. We've got some videos that we're sharing. And with our colleagues at the World's Continuing Education Alliance, in the next few days, an app which includes learning materials and emergency response will be coming forward. And of course, as Annette has been very clear, we're also then informing the big public health messages as well in terms of testing, surveillance and isolation, and seeing how both individually but also through their associations, nursing associations are playing a phenomenally important leadership role. Elizabeth, I'm now going to come to you, please, for an overview of the nursing response from WHO. Elizabeth.
Thank you, Howard. Thank you, Annette. Thank you for the invitation to be a part of this webinar this afternoon. As you mentioned, last year when the World Health Assembly designated 2020 as the International Year of the Nurse and the Midwife, in recognition of the vital role and contribution of nurses and midwives to universal health coverage, that decision effectively had the spotlight on nurses and midwives. COVID-19 has put nurses and midwives on the spotlight also, but not for reasons we want. But we should, as Annette had mentioned, consider the lessons learned to support the way forward. The Year of the Nurse and the Midwife has the excellent opportunity to leverage for greater investment in nurses and midwives, and to realize what more we could achieve and contribute to universal health coverage and the SDGs. The global nursing and midwifery workforce were mobilized with exciting plans for the year when this announcement was made, and also for beyond 2020, with a call to a decade of action for nurses and midwives. We saw it as the opportunity to leverage and to strengthen nursing leadership and influence policy decisions. It was an opportunity for more investment to address the 9 million nurses and nursing and midwifery workforce shortage, and invest in education, regulations, and improved employment conditions. And it was also an opportunity for advanced nursing practice and advocating for more nurse and midwife-led clinics and practicing to their full scope of practice of their license. And it was also an opportunity to ensure gender equality. These are important elements that can contribute to better working conditions, job satisfaction, safe working environment. And it was anticipated that this would be supported by data and the evidence from the first State of the World's Nursing Report to be launched on the 7th of April on World Health Day. And countries would be supported to influence policy decisions as per their context and their priorities. These plans are still in place, but due to the outbreak of COVID-19, we are reframing how we take forward these plans. As the COVID-19 crisis has evolved, we have witnessed nurses and midwives courageously stepping up alongside their co-workers to care for patients with compassion and commitment, and working tirelessly and selflessly to make sure patients are cared for during this crisis. What is interesting to note is that the agenda we had for Year of the Nurse and the Midwife are relevant and is implicating our nurses and midwives in this COVID-19 epidemic. At the same time, I am deeply saddened when I get emails or told stories and see videos about those that have been infected and those that have died in the line of duty. We do not have inaccurate data on the number of healthcare providers who have been infected or have died as a result of COVID-19, although we are seeing countries and hospitals releasing some data on this. And again, as you've just heard Annette mention, some data on the infection rate and the fatality. Understanding that gathering data during emergencies is often quite difficult. And until a few weeks ago, gathering data regarding health workers specifically was quite low on the radar. But we recognize the importance, especially, of knowing about infection and fatalities and gender, not only for future studies and public information purposes, but also to detect gaps in training or equipment where health workers are not only victims, but vectors for infection, and where those factors can be mitigated, and especially on issues related to worker protection and decent work, with efforts to provide focused support to regions and countries, especially with low resource environments requiring adapting approaches. My colleague, Catherine Kane from the WHO Health Workforce Department, and engaged in some of these guidance, can elaborate more on this ongoing work. And I understand another colleague, Maria Clara Botoves, a registered nurse and infection prevention control expert in the WHO IPC unit, may also be available to elaborate or respond to questions on the ongoing development guidance around IPC as part of the response to COVID-19. WHO have been working in collaboration with key nursing and midwifery partners, with ICN, with ICM, with the Nursing Now, and with UNFPA, to maximize on the significance of the Year of the Nurse and the Midwife, to leverage what more could be achieved, and especially during this COVID-19 crisis. The WHO Director General, Dr. Tedros, is chairing this high-level steering committee made up of leaders from this organization, including, of course, the President of ICN, Annette Kennedy. And as she mentioned, they have raised the issues of extension of the Year of the Nurse and the Midwife celebrations. Just yesterday, I heard an internal WHO all-staff virtual seminar to reorientate everyone to the Year of the Nurse and the Midwife, with the focus on implications of COVID-19 on nurses and midwives, and invited nursing and midwifery colleagues working in country offices and in HQ to hear their perspectives and work that they are doing. It is really important during these difficult times that we continue to reach out to each other for support and to share our experiences and learn from each other. So thank you, ICN, thank you, Howard, thank you, Annette, for your continuing engagement to support nurses and midwives everywhere. Thank you.
Elizabeth, thank you so much for that overview, for your work, and for finding the time for us. As Elizabeth said, she's also joined by two other colleagues from WHO, Catherine and Maria Clara from Workforce and Infection Prevention and Control. Catherine and Maria, I'm going to come to you now. Could I ask if you're able to, between you, take the next 5 or 6 minutes between the two of you? That would be great. Catherine, I will come to you first.
Super, and admiring your very, very nicely directed ask for brevity. I will try to follow through. And thank you for this opportunity. Just as a quick note, I come from the Red Cross, where I used to work with the chief nurse on standards of practice and working to the full extent of licensing. I was reminded that the creed of the Red Cross nurse is, wherever disaster calls, there I shall go. I ask not for whom, but only where I'm needed. So while we appreciate that voluntary service, while we appreciate the care that nurses give, we're also concerned with a wide range of issues related to health work from the Health Workforce Department. We are concerned with a wide range of issues that are affecting all health workers during this COVID-19 outbreak. We started, along with colleagues from Occupational Health and Safety, on a document that outlines the rights, roles, and responsibilities of health workers, including occupational health and safety. And that swiftly followed with the collaboration of our Health Emergencies Department of a health worker risk exposure assessment tool. Both of those are on a link that I'll share just after I speak, where we collected a range of tools and information and guidance for health workers. We've been through the WHO Information Network for Epidemics, EpiWin, which is a new initiative. We've been sharing weekly calls, situation updates, and features on mental health, psychosocial first aid, resilience, lessons from the field, and physical distancing, among others. Every week with healthcare professional associations, and ICN has been an extraordinary partner in those webinars. We have been developing materials focused on health system functioning, both during the response to maintain essential health services, at how to do COVID-19 specific response. This includes a health workforce modeling tool that we'll be releasing next week to assist health facilities in figuring out what they need, especially for the high-level critical care that is needed for approximately 20% of the population, but also looking along the continuum of the 4 C's, which is no cases, sporadic cases, clusters of cases, transmission, of which we realize that you are on the range. And fortunately, some of you are on the far range of community cases where you've seen the cases going down. That is due to the work of health workers, it's due to the work of nurses, and it's due to our collaborative work to ask people to respect the work of health workers by staying at home, maintaining distancing, and following hygiene, which is what nurses have been working on for years. When we look at scaling up essential health personnel, we know that especially specialty nurses are highly in demand, and we look at rational ways to use different members of the health workforce, whether it's in mixed teams in an ICU setting with one highly experienced individual leading that team, or whether it's ensuring that newer health workers or retirees or recent graduates are doing non-COVID-19 tasks. We're trying to look at the appropriate mix of roles that ensures supervision of all health workers and of management of that worker protection that involves ensuring that working hours are decent so that we avoid burnout and fatigue, which is when infections tend to happen, and ensuring that all of the procedures for personal protective equipment are followed, and looking at training and ensuring that there is appropriate correction when errors are seen within the system. Lastly, we are, through the WHO Academy, looking at rapidly scaling up, and this is based on starting last Friday, rapidly scaling up some poll information that'll be delivered via an online app that we hope to launch at the beginning of next week, followed quickly by training opportunities, training and learning that includes some of the existing products, but also at virtual delivery of workshops and webinars to upskill dramatically for health workers, especially on the topics that they have identified through a survey. I'll also share that link. Most important to them. And so far what we're seeing is clinical management, infection prevention and control, and personal protective equipment are the highest level issues for the workforce. We cannot afford to have fewer nurses. We need twice as many. And the last thing that we want right now is for there to be attrition, whether it's due to infection or unfortunately death, or whether it's due to burnout or lack of attraction to the profession. What we want to see is that nurses are valued more for the work that they're doing, and that they have the appropriate supports to do so. And that is in line also with gender considerations that I think Elizabeth has already looked towards, and that are fully and well represented within your profession. And lastly, what I can offer you is my colleague who can address questions related to IPC and to PPE more thoroughly with regard to the WHO guidance in those areas.
Catherine, thank you so much for a real sense of the breadth of workforce agenda and work that's happening. And of course, one of our real concerns is to make sure that that work that we do globally hits the ground and makes a difference in practice. We've also got some work in the pipeline with ICRC that we're hoping to bring forward next week as well. But Maria, over to you on the IPC issues specifically. Maria.
Okay. Thank you very much. I would like to thank you, the ICN, for the opportunity for sharing information, and also for this creating this channel of communication. So I have just a few words to say that the infection prevention and control in the context of COVID is really challenging today, because we know that we are still lacking evidence, scientific evidence for several things in terms of this new coronavirus. But I would like to share with you that we have in the WHO some researches in terms of guidelines. So I showed here the link for getting all these guidelines. The next slide, please. In the next slide, I have the list of guidelines that are available. Some of them are now under review, because as we are receiving and getting more information on the situation, we needed to review. So the updating of documents is really very quickly. And I think it's relevant to say that these guidelines are being informed not only by the scientific, current scientific evidence that we have, but also in consultation with more than 100 experts, IPC experts all around the world. We have weekly meetings with experts. We have weekly meetings with regional focal point that bring to us what are the challenges, what are the difficulties. So we are trying to deliver guidelines that not only evidence-based, but also feasible. The next slide, I would like to just very briefly to say that we have some pillars in terms of IPC, beginning with ensuring triage, early recognition, and source control, especially isolating patients with suspected COVID, or of course confirmed as well, and applying standard precautions for all patients, even when we do not know if they have symptoms or not. The standard precautions have been shown important measure to prevent infections, not only COVID, of course. And once we have any suspicion or confirmed the case, is necessary to implement droplet and contact precautions. And when we performed aerosol-generated procedures, is necessary to add airborne precautions, just for this kind of procedures. In general, in ICU, it's very common to have this kind of procedures. But not only about PPE, it's important to have implementation of administrative controls, as well environment and engineering controls. I would like to reinforce that among implementation of administrative controls, is important to have a good ratio of staffing levels, nursing, patient staffing levels, because of course it's important to have enough people to take care, because it's very demanding, donning and doffing PPE and everything that is necessary to keep with infection prevention and control measures. So we are advocating not only for having good use of PPE, but very important to have as well other types of measures in agreement with the guidelines. So this includes infrastructure also for hand hygiene and other engineering controls to avoid to avoid too much contact and to allow the distance, social distance. So the next slide, just to remind everybody that in general, we have this hand hygiene campaign. In this year, we already planned to align with the International Year of the Nurse and the Midwife to acknowledge the importance of nurses and midwives in infection prevention and control, not only for because most nurses and midwives, they play a very important critical role for clean and safe care, but also many IPC personnel are nurses, as I am nurse and IPC expert. So we would like to invite you all to join our campaign. We are advancing this campaign to align with the campaign to fight COVID. So I hope we can join us. I will share with you later more information. Please, the next slide. We have several materials already available for improving hand hygiene in healthcare settings. And as we have more information, I will share with ICN to share with others also. So in saying that, I would like to thank you. I am very open to your questions, to your comments. It's really important that we stay connected, we stay in contact to have a joint initiative to fight this COVID. Thank you very much.
Maria Clara, thank you very much again for that comprehensive run through, all available on the WHO website. For those of you who are asking, all of these materials and the presentations will be available afterwards. And also to say, I know that a number of our associations have produced their country-specific guidance. I'll get in trouble by mentioning just one, but I know that the American Nursing Association, who are on the line, have got some excellent materials. Many other associations have as well, and we will be coordinating and circulating those. But having had the that overview of the global work, I think that what we are all desperate now to hear are those people who are at the epicenter and on the ground of dealing with this. So first, I'm going to go over, Jose Luis, to you, the Deputy Secretary General from the Spanish College of Nursing, for your presentation. Jose Luis, to you.
So, good afternoon. First of all, I wish to thank you on behalf of the Spanish General Council of Nursing and the 300,000 plus nurses we represented in Spain for the opportunity to participate in this webinar. Thank you very much. Please allow me to use my first words to remember one Spanish nurse and two physicians that died after contracting the coronavirus while providing healthcare. Let's hope we don't have to regret the loss of more healthcare professionals. I also wish to remember all the citizens that have died unable to recover for this disease, and their family members who could not be close to their loved ones, no said goodbye to them. I know I have little time able in this intervention, but I will try to explain the situation in our country and the action carried out, in particular those by the Spanish General Council of Nursing. The current situation in Spain, according to today's data, we have a lot of, you can see here, around 65,000 positive cases, and a lot of people die. But I think the most important is this data here. It's around 10,000 infected healthcare professionals. Most of them are nurses. It's accounting for around 15% of the total infection. So I think it's a very important number of professionals, health professionals and nurses. There are more information in the website of the ministry. In any case, according to what experts tell us, we should be about to pick off the epidemiologic curve. Allow me to describe the milestones so far to explain Spain's current situation. We learned about the first case in China at the end of December of the last year, and the Spanish government started to hold different meetings with those responsible of healthcare in our regions around January. At first, experts and spokespeople from the ministry minimized the situation, sending out the message that we would not have many cases and everything will be under control in Spain. At the end of January, we identified our first case, and we had our first victim around 13 February. But the news of this die was public 20 days after the patient death. So around 2 March, the Spanish General Council of Nursing and the rescue of the healthcare minister used a communique recommended the suspension of a scientific congress and celebration of events and a lot of meetings. However, the Spanish government did not recommend the suspension of football matches, mass meetings of political parties, or the demonstration of in the streets of the 8th March. The same day, 2 of March, the Spanish General Council of Nursing, with the scientific societies, with a lot of people, we set up working groups to draft protocols and recommendations to prevent contagion. Around 9 March, when we already around 1,000 positive cases in Spain and 16 deaths, some regional governments began to take measures to prevent transmission, like Madrid, for example, where educational centers were shut down, universities, schools, etc. However, the state of alert confining people in their homes was not declared in Spain until 14th March, when there are around 6,000 cases and more than 100 deaths. As we have seen, healthcare authorities have been aware of the magnitude of this epidemic for 2 months in our country. However, they have not planned according to provide the personal protecting equipment that healthcare professionals need. So they have been forced to make their own equipment at home using garbage bags, household material, etc. There are not enough masks, coats, glasses, face protection screen, etc. The Spanish General Council of Nursing has revealed to the media that the working condition of our healthcare professionals many times. We have also sent letters to the National Health Minister, as well as to the regional ministers and to the Prime Minister of Spain, to request that the necessary protection equipment is provided urgently. We know there is high competition internationally to buy such equipment, but in Spain there has been lack of foraging because purchases should have begun much early. On the other hand, there are not enough tests to diagnose the infection in the population nor in the healthcare professionals, so we don't know the exact number of infected people. On the other hand, in terms of human resource, we should keep in mind that Spain is a country with one of the lowest nurses patient rates. The European Union average is around 8 or 9 nurses per 1,000 population, but in Spain we have 5 nurses for 1,000 population. So we have had to ask professionals to move between regions. Retired professionals have been asked to get back to work, and the government has implemented a role, but by which students in their last year of the nursing and medicine degrees can have a healthcare help. It's a contract to hire healthcare professional and accelerate the profession to recognize, for example, the qualification of nurses from another countries outside of European Union. So I wish to mention the problem we have to face together with the Spanish university, because students practice hours in the last year of nursing and also with other disciplines have been suspended, and therefore we don't know how they will be able to conclude their studies this year if they don't complete the number of practice hours required by our European directive. So we also like to mention that due to our large number of patients, additional locations have been set up to take care of them. Hotels have been converted into hospitals to free up space in actual hospitals, and in just 1 week, a 5,000 bed hospital has been set up at IFEMA. It's a conference venue where Congress are usually held, which is an impressive as the hospitals that were built very quickly in China. All this has been possible thanks to the work of hundreds of people, even altruistically. Last but not the least, I wish to highlight the situation in elderly homes where many people have died, mainly due to their characteristics and old age, but also due to the lack of protection equipment for professionals to work. I wish to conclude by explaining briefly the action carried out by the Spanish General Council of Nursing. We have a platform called Nursing Unity with Nursing Union, Trade Union, ITSATSE, Nursing Scientific Society, the Association of Managers, the Conference of Nursing Deans of the All University, and the Association of the Nursing Students. We have made joint statements revealing the situation in which our healthcare professionals have to work. We are some protocols. We have a lot of information. We made it with the Scientific Society. With our research institute, we prepare posters, videos, and documents with recommendations for professionals and for the general public. You can see all this information in our web page. I know I have little time able in this intervention, but I will try to explain. I have to finish with more action from the Spanish General Council. For example, with a continuing education, we have a seminary. It's a 1-hour refreshment course updating coronavirus knowledge for action for professionals. It's now around 10,000 people are making this course. And we have writing letters to the Spanish Prime Minister, as well as to the Healthcare Minister of the regional ministers, every political people. We have developed other actions too, and we will continue to develop more, but I will not go into details for time reasons. All actions allow us to showcase the value of the nursing profession. Let me conclude by launching a message of encouragement and hope. We will defeat this virus together. Thank you very much.
Jose Luis, thank you very much again for a fantastic insight into the work of Spanish nurses in the Council. Colleagues, I've still got people who are joining this webinar. I know we're coming up to the top of the hour, but we are going to continue to hear from the two remaining presenters. I have already seen the presentations. I know how valuable these presentations are, so please stay with us. I don't think your time will be wasted. We will continue until we've had the presentations from our colleagues in Italy and Switzerland. And Jose Luis, I thought the importance of speed of testing and of PPE, really valuable points that came out from your presentation about those countries who are not in an epicenter yet, what they should be focusing and concentrating on. Walter De Caro is the president of the Italian Nurses Association. He's been working day and night, and I know that because he sends emails to me day and night. Walter, what you've been doing in Italy has been fantastic. Over to you, sir, for your presentation. Walter.
Yeah. Good afternoon and nice to meet you. Nice to all, and abbraccio to José and Spain nurse and the other nurse that live these problems. You see my presentation? No, more or less.
It's good. We see.
You see now?
Yes.
Okay.
See very well.
Yeah. I speaking. We have this outbreak from 30 January with two Chinese tourists in Italy, but the real outbreak starting 21 of February is 1 month and a few days now. And 8th of March, we have the lockdown of all countries, extended lockdown of countries. About all is closed, about all public office is in smart working. We have now 80,000 people positive. Of this, we have also, this is a real problem, we have also 88,000 people died. And the other problem that we have more or less 30,000 people in the hospital. Of this, about 4,000 in intensive care unit. And this is a real problem for Italian nurses. About the cases, at least 70% of cases of died is people of over than 60 years. The medium age is 65. The organization of emergency in Italy have 3 levels. The first level is national level. At national level, we have a task force. In this task force, there is also sometimes representative of nurses. At second level, we have regional task force. The region, Italy have 20 regions, and we have a real problem in 3 regions in the north. And the last level is the hospital level, the field level, where the director of nurse have a crucial role. About the change COVID related. For the organization, about all the hospital in Italy is reconverted in COVID area. In some region have a specific COVID hospital. In Lazio region, we have 5 COVID hospital in Rome. The other is generic hospital. In all, about all the hospital, we have pre-triage tents, and now stay moving for COVID tampons outside. What is the problem? The problem is in Italy, we have a real problem of lack of nurse, not a real lack of nurse, is a shortage of nurse, or is better, I see, the government don't have money for new nurse. And we have in Italy 50,000 nurses. We have necessity of 50,000 nurses more. In this moment, government recruit new graduated nurse, retired nurse, and people, nurses from the organization and education. At the same time, there is the support of military health system and the support of Italian Red Cross and the support of some country like China, Russia, Germany, European Union, and Cuba. In this moment, we have a new organization movement that is a new task force. This is a national task force of general direct civil protection. This is 200 doctors and 500 nurses that move in all Italy where there is a COVID outbreak, move from north in other place of country and is paid more respect other. The problems, we have a 9% more or less of health professional with COVID positive. One problem is the lack of PPE. There is a general lack of PPE. In south of Italy, there is no PPE at all in some region, in some country, in some town. Other problems is the confusion. The first day of this outbreak, there is no general awareness about COVID, and also some confusion in the mask. Some use surgical mask, some use personal mask, like in Spain, because there is no PPE, and this is a problem. Another problem is the scarcity of tampons. There is a lot of regional difference. There are a lot of regional difference. Some region decide to do tampons at all people. Other region decide to only for people with clear symptoms. With COVID, that is a problem also without symptoms. This is not a good idea. Now, after also the help of ICN, the Minister of Health decided to do tampons for all health professionals. That is in progress now. But persist some problems in communities, in health communities office, because we concentrate the attention all for the hospital. About the people that died, we have 44 doctors. Most of this is general practitioners. This is people that stay in, doctors that stay in front line. We have also 5 nurses died now. And about the infected health professional, there is a difference in the region. In Lombardia region is more than 13%. In Sardinia is about 40%. In Lazio, Rome, is 4%. This is the difference, respect the readiness, I think. The other people is, we have also, this is a very problem for me, we have 2 nurses suicide, as 2 nurses, one of 34 years and one of 49 years that work in COVID department. One is positive and one is suspected positive, but this girl don't have the force for this, because a lot of work, because you see a lot of people that died and without support, at least. This is a crucial problem now. This is a stress and exhaustion. Is a crucial, give some mental health support now, I think. Other problems is especially in some area like Bergamo or like Brescia now, is in the north, in the Lombardia, is localized, that are some old people is not candidates for resuscitation. Older people with different pathology sometimes is not candidate for resuscitation, but these people in common condition is candidate for resuscitation. But now we don't have enough beds, enough health personnel, enough anesthesiologists, enough ventilator for this. And in some situation, there is this. The last things, there is some reflection. In Italy, we have more or less an half bed of 20 years before. In 1998, we have more than 300,000 beds. Now we have less than 200,000 beds. At the same time, we have less than 3% of intensive care beds. And before we have more than 5% of intensive care beds. At the same time, we have a real shortage of 15,000 of nurses. this is a problem because the political is a political choice, because in the last year of crisis, the politicians decide that the sacrifice is for health of people. And I hope also to change something in this day for the contract of this nurse for COVID. All the nurse for COVID is in temp contract. It's a contract of 6 months, sometimes with the low level paid. And at the same time, we have a positive things for, we have to use this opportunity for new reflection about health system and about nursing. The last thing is that we have a great approach on media and on citizen. Nurse is like heroes. Now there is an approach about the nurse every day on the newspaper, on TV, speaking about nurse, but nurse earn, in Italian nurse earn 1,500 euro a month. 1,500 euro a month is the nurse that work 12 hours a day in a COVID department. Thank you, and sorry for my Italian English.
Walter, please do not apologize. That was an incredibly powerful presentation. I think you demonstrated what happens when a health system becomes overwhelmed. You've reinforced why all of the message of preparedness and speed are so important, but also when a system becomes overwhelmed, what the impact on nurses, on health workers are directly on their health, their workload, the decisions, the impossible decisions that we put our health workers having to make. Listen, we're very grateful for you sharing that in such an open way. I know it's not difficult when it's your country, it's your people as well, but we sincerely thank you for it, Walter. And finally, I'm going to come to one of the ICN board members, to Roswitha Koch, who's also the head of the Nursing Development Department of the Swiss Nurses Association. Roswitha, to you.
Thank you, Howard. I prepared some slides. So if you could put them up. Yes. And you can please move to the next slide. Thank you. So, dear colleagues around the world, I would like to start this presentation with expressing my condolence for all the people who died of COVID-19 around the world. We from the Swiss Nurses Association are heartbroken about the nurses and their colleagues that got infected, ill, or even died due to COVID-19 epidemic. Every day we think of our friends and colleagues in Italy, in Spain, and other countries. Some of our colleagues died of infection, some of exhaustion, and some of hopelessness. In this difficult context, I'm so thankful that ICN, Nursing Now, and WHO are helping to raise awareness and are raising the visibility of nurses and supporting the nurses in such difficult situations. To help, now I'm getting to the situation in Switzerland, and to help to put the current corona situation in a context, I will first present some specific sides of my country. Switzerland is a small country in Europe, sharing a border with Italy, France, Germany, Austria, and Liechtenstein. We have a very liberal society and a very mobile society. As it takes only a few hours to go to Milan, to Paris, to Berlin, we are people who are, many of our people like to move, to go for weekends to other countries or for holidays. So the majority of our first cases mid-February were Swiss people having been for congresses or for pleasure in places like Milano or Strasbourg. 8 million are living in our country. And additionally, many of our workers are living in the neighboring countries and working in Switzerland. To give you an example, there are 30,000 nurses and doctors crossing the border every day from France to work in Geneva or to work in Lausanne. We are so much depending on nurse migration and on these frontaliers who support our health system, because compared to other professions, the nursing profession in Switzerland is just not attractive enough for young people. In some units of Geneva Hospital, there are 80% of the nurses working there crossing the border from France to Geneva every day. The situation between Ticino and Italy is similar. We have very open borders. People live, work, shop in the neighboring country. As a consequence of our open and exposed position, there are different elements that make our health system fragile, despite the big resources, despite a basically well-financed health system. We are heavily depending on professionals who live in neighboring countries and professionals who migrate to our country. When he closed the border, closing the border in the situation of an epidemic can therefore have very dangerous consequences. We might be able to reduce infections in the COVID-19 epidemic, but at the same time, people would die of neglect or have severe problems because all the health workers from the neighboring countries could not come in. As I said, we are a very mobile society, and within the country, with many people traveling abroad, we hugely spread across the country SARS-CoV-2. Additionally, there are many essential products in the situation of an epidemic which are produced somewhere else. All the personal protective materials, for example, is produced mainly in Asia, and we have the big challenge first to buy it and then to bring it to the country, because currently it's not always sure material can pass the border. Another element that will contribute to overloading our health system is demography. Like in Italy, the proportion of older people is continuously growing. Currently, 20% of the population are older than 65 years. And now I would like to get to the development of the epidemic. On this curve, you see the curve on the screen, you see different lines. The red line is the Swiss development. The blue one above is Italy, and far below we have, for example, Japan and Singapore, and the green one is South Korea. So you can see that Switzerland belongs to the country with the fastest raising of infection rates. We have really, since mid-February, had a surprising difficult time with the infection rates raising. Switzerland has over 1,100 COVID cases per million inhabitants. That means we are second after Italy. Numbers of cases have rapidly increased, similar to the situation in other countries in Europe. On the 17th of March, our government has decided on a partial shutdown, which means that people now should stay at home. Shops are closed, restaurants are closed, schools are closed. And when you look at the epidemic curve 10 days later, we are hoping that the curve would flatten. We are still not completely sure, but there is some indication that our epidemic curve will slowly flatten. That means that we would have less new cases every day, or at least a stable amount of cases. I give you some more figures about the epidemic situation now. We have over 11,000 cases. We have 194 people who died. There are 1,004 people in hospital care and over 200 in intensive care. And when we look at the evolution in countries like China or Hong Kong or Spain, we know that there will be many more heavy cases in the coming weeks. So we also are aware that our intensive care system is soon getting to its limits. There has been very little corona testing in the beginning because we didn't have the materials. Currently, this has been scaled up, and now there are 10,000 tests by 1 million people. I think we are getting closer to the situation in Korea, where they have succeeded in flattening the curve before us. We know there are already quite a number of health workers affected, but there is no surveillance, there is no system, no reporting system, so we have no official information, but we know that there are people affected. And like every other country, we do not have enough personal protective equipment. The equipment has been lacking right from the beginning. There is no masks, for example, or very limited numbers of masks for home care nurses. If they go to see vulnerable patients, they often do not have masks to protect the patients. And partly they also do not have masks, face masks, when they go and see infected patients. So when we look at the publications from China and other countries, which are very helpful, and also the sharing of experiences is very helpful for us to take certain measures earlier than we would if we could not learn from others. We are really expecting a heavy time in the coming weeks, and we will need more intensive care nurses, and we will need more intensive care and ventilation. Ventilation is there, the machines are one thing, and I think production is speeding up with building machines. But what is really sensitive is the limited number of intensive care nurses. These highly specialized nurses are here, but they are very limited. So in this point, we're soon reaching our capacities. In some regions of the country, like the Hygiene or the southern part of Switzerland, the capacities are already overstretched. For the expected shortage of health professionals, our association is helping the government and the cantons to recruit nurses who had left the profession. So we got now more than 2,000 volunteers, and these volunteers, we are insisting they should not work for free, but they volunteer to get back into their profession, but for correct support and salaries. And there are also some major activities in having third-year students helping out in the different health structures. You can show the next curve or the next slide, please. Here you see the speed of the spread, and also here, when you look at the red line, there is some hope that the spread will slow down. It's the highest, the orange curve is the US, and the purple curve that has already, that is almost down to 10, which is very down, is South Korea. So the Swiss Nurses Association has two main objectives. We want to help to get through the crisis, to support the government and to support the structures. We are sending out messages to the population. We remind them to stay at home and to really stay at home and not visit friends or go for walks in the parks. And we also talk a lot to the media. This year is the year of the nurse, and this year is also where our popular initiative is discussed by the parliament. In the beginning, there was little hope that they would follow our suggestions, but now we can renegotiate, and we hope the nursing situation could get better after this pandemic. The second main objective of our association is the protection of the right of the nurses. The Swiss labor law has been loosened for people working in healthcare system. The obligations to have enough resting time, to have enough time off, holidays, has been removed for the following 6 months. And we have also quite some problems with the protection of the healthcare professionals. Like currently there are discussions whether pregnant women should have special protection or not. And I'm very thankful to my colleagues from Spain and China. They could tell me about how they handle the situation, and we will follow their solutions. So to finish this presentation, we are extremely thankful to get advice from ICN and from our colleagues in Asia or Spain to learn how to handle all these new upcoming problems.
Thank you very much, Roswitha, again for such an incisive and detailed analysis of the situation in Switzerland. Unique learning from there in terms of a small country as well, but surrounded by countries who are, really at the centre of this, and then what the implications are for Switzerland. I don't know about you, colleagues, but I've been really struck by a sense of, I don't think I've ever felt so strongly, this sense of being part of a global profession, and the irony that at the time that everybody's isolating and distancing, this thing seems to be bringing us closer together than perhaps at any point in our history. I'm going to hand back to Annette in just a moment for closing words. I know that we've run over. You have stayed on. People haven't dropped off. So I know that it's clearly been valuable to you. We would be doing more of this. We'll be sharing the learning from today, but we will be doing more webinars to share learning from other countries as well. 2 dates that I just need to remind you of, colleagues. The International Nurses Day, as you know, is the 12th of May, but next week ICN will be releasing our publication and resources for International Nurses Day. We always do that in advance of International Nurses Day so that you have it to prepare whatever you are doing on International Nurses Day. So look out for that. Nurses a Voice to Lead, Nursing the World to Health, as the President has already said. That's a title that we didn't need to change, more apt now than when we decided upon it. That's next week. The week after, colleagues, the State of the World's Nursing Report will be released. You know it's coming. You know it's the first time that we've had such a report. Again, I don't think it could be more timely. The evidence in that report, the recommendations from that report now become a must-do to implement, not optional, not negotiable. In the context of COVID, that report must find its way into political and policy decisions. Colleagues, we've had 1,000+ of you registered for today. We'll let you know the final number of countries, but I think it's probably 60 or even more. My sincere thanks to all of the speakers, and for those of you in particular who've shared your experiences when that has actually been incredibly difficult, and you're still going through it. Our hearts, our thoughts, our minds are with you. On behalf of all of us, you know that we stand in solidarity with you. Annette, I'll hand back to you for the final words.
I'll be brief. I just want to thank everybody that took part in this webinar, and also the presenters. You have no idea to our NNAs how invaluable your information was today. We need to hear more of that. We need to know a lot of issues that came up there. We've heard, but we really haven't heard it in detail like we heard from you. And that is so helpful. We need to hear more of that. We need to share more of that. The one thing that I will say is that we remember Tedros' words: fight, unite, ignite. We are stronger than the virus, and we will win. I have no doubt in my mind about that. It has made us as a family stronger, and I am very proud to be a nurse. It's unfortunate that it's this terrible time, but I am proud to be a nurse. I would like to wish you all luck and thank you so much for everything. And as you go about your daily duties, just remember the words: you wash your hands, cough into your elbow if you haven't got a tissue, don't touch your eyes, keep 2 meters apart, stay at home, and tell everybody you meet. So let's go forward. Let's try and help each other as much as we can. I am so proud of everybody, and I wish you all the best, and I wish you to stay strong and healthy. Thank you so much.
Thank you, everyone. Take care.
Thank you. Thank you.
Bye-bye.
Bye-bye.
Bye-bye. Bye-bye.
Thank you.